Aloha kakahiaka. Good morning, everyone. Thank you so much for being here today. We're going to start AlohaCare's internal webinar series, Enlivening a Culture of Health, today for our 4th episode shortly. As we welcome our teammates, please familiarize yourself with the Zoom webinar features, which are a little bit different than Zoom meeting that we usually use for our group discussions. We'll be having a presentation, so if you can view your screen, our guests will be sharing important work, videos, and examples from Sustainable Molokai. As a reminder, please join this webinar live without logging into Citrix or VPN. You can do that through any internet browser. Chelsea is putting the information for you now into the chat. You can just go to zoom.com, click Join Meeting, and we have inserted the web ID and the passcode for you. So you can do that from Google, Chrome, Internet Explorer. You can do that even from your phone or tablet. This opening slide has 5 things to look at on your screen. Since we're not able to have these important and sensitive conversations together, we're trying to make this as interactive as possible. So we want you to take notice of the chat box. You'll see that blinking. It looks like a little bit of like a talk bubble. In the chat box, we'll be sharing links to resources, and you can also send a message to me, Chelsea, or Clayton at any time. Also, take a look at the Q&A box. There you can anonymously ask questions of our panel. And that will be important for us as we have the discussion feature later. And that's easier for us to see rather than in the questions in the chat feature. Lastly, we're also recording a session for staff who are unable to be with us live. So if you want to rewatch this later, Clayton always puts it on Aloha Lines, and then we do also make it publicly available on AlohaCare's YouTube site. The recording is off of the screen and our audio, so you yourself as an attendee are not being recorded. Neither is the chat box. So we can't see you and we can't hear you in the recording. As a reminder, this webinar is a safe anti-racist space led by the values of Hawaii. And so we encourage everyone to think through our lens of being diverse and being inclusive. With those brief tips to orient you, let me warmly welcome everyone back to the Enlivening a Culture of Health webinar series. This is our 4th episode, and we'll be focusing on how food and community subsistence programs are thriving in the neighbor islands of Hawaii. Sustainable Molokai is celebrated in the 2018 Department of Health's publication, Advancing Health Equity Through Hawaii's Food Systems. Their programs are celebrated in this report for building community-based food systems. It's National Nutrition Month, so a link to this helpful report has been placed in the chat for you. For those of you joining us live, go ahead and insert any questions you have now into the Q&A, and we'll be sure to bring that up later for the discussion portion. And just to get us off and get us all, talking with one another virtually, insert a favorite healthy food of yours growing up into the chat feature for all of us to see. For myself, I always think of the orange tree in my grandma's backyard and always having fresh oranges, especially during the summer on hot days. That was always a great childhood memory. But National Nutrition Month isn't easy for everyone. It's not just about eating healthy foods, it's about the entirety of the food system, our access to it, the affordability, and the way that the food system itself is structured. And this is part of the way that we're prioritizing social determinants of health at AlohaCare. The social needs of our members are just as important as the medical health needs. Our SDOH work plan and strategy is outlining opportunities across the work that we can do. Today, we're going to focus on one of those domains, the food and natural environment. It's core to the work that we've adopted and the priorities our team is leading ahead. As customary in Hawaii, we start this webinar by acknowledging the land and the natural environment as the preeminent source of Mauliola, health and life and vitality among Kanaka Maoli as the indigenous people of this āina. This is a historical map that depicts the land area of AlohaCare's headquarters now at 1357 Kapi'olani Boulevard in Honolulu. Before this area became known as Ala Moana and synonymous with the current shopping center, this land was actually occupied by a natural coastal wetland local i'a, which we refer to as traditional aquaculture ponds, and lo'ikalo, which were irrigated terraces for kalo. In fact, the name Ala Moana isn't even the traditional name of this area. It's Inoa Maoli. The original name of this land area is Kalia. Kalia is actually the name of a sweet potato called uala, grows specifically in this area. Uala is a staple in the traditional Hawaiian diet, contributing to healthy and vigorous Native Hawaiians. So no, the cultural foods of Kanaka Maoli are not lokomoko and plate lunches. Our cultural foods are kalo, uala, and ulu. These are staples that grew right where our headquarters are today. It was a place that was frequented by birds, koloa, or native ducks. When we think about food and the causes of food insecurity, it's important for us to know about these histories and these changes over time that have led to the state that we're in today. I'm going to start by launching our first poll. So you'll see the poll pop up on your screen. And go ahead and take a guess. Our first question here is about indigenous farming techniques. So I just told you about our place of kalia, of kalo and uala and the koloa. Indigenous farming techniques traditional to Hawaii could produce how much food do you think to feed Hawaii's current population? If we were to reestablish these areas and these techniques back across the islands and areas into places like Kalia once more, how much do you think that might be able to produce for all 1.2, 1.3 million residents right now? Go ahead and keep voting. We're going to go ahead and continue on. And I will start with an introduction. It's really a pleasure for us today to be able to introduce our esteemed guests who are highly regarded and respected community health leaders in their moku. AlohaCare is proud to support the work of Sustainable Molokai and was able to provide a nominal sponsorship to support their critical work during COVID-19. What caught our immediate attention is how Sustainable Molokai and their leaders quickly responded to working together and providing food amid an island in a pandemic. I was lucky enough to be invited to several of the Molokai community meetings in the early weeks of the pandemic, where folks were busy mapping the entire food system to locally source eggs, fish, produce, fruit, and even deliver it to people who did not have a car or those who were staying home due to quarantine. I'm thrilled to introduce and welcome Harmony Williams, the Executive Director, Christopher O'Brien, the Director of Administration and Development, and Matt Yamashita, Sustainable Molokai's Board Vice President and founder of Quasi Films. Before we watch a brief video, I'm going to end the polling here, and we'll go ahead and give you a little the answers and context a little bit later. Thanks everyone for voting.
With the average age of farmers close to 60, probably the most important thing we need to focus on are new farmers.
We're excited to partner with Sustainable Molokai because they are well connected in the ag community, and we realize our community really has the need for increased crop production.
Homesteaders on the island have access to water and land, and a lot of them are good at growing things, but what they lack is the science of agriculture and the business aspects of agriculture.
Through this partnership, our students will have access to content-based courses in field crop production as well as internships.
If we had internships in farming that were paid, who would be interested?
Ms. Moore.
Our main goal is to connect local farmers with consumers here on island.
Having a market really helps the farmers focus on production, focus on the aspects of farm as a business.
Obviously, when you buy food locally, it's not traveling 2,000 miles from the mainland, and we're really helping with food security for the island.
We keep the money on the island, and we're able to improve our economy.
So at this time, I'm going to turn it over to our team at Sustainable Molokai, and they're going to provide us with a brief presentation and overview. Then we'll go into another poll and a discussion, and we're really interested in your folks' questions and ways that we can engage community leaders just like this across the food system. Harmony, go ahead. I'm going to turn it over to you now.
Great. Thanks so much, Aloha. Aloha, everyone. And like Kealoha started out, I just wanted to acknowledge where I'm calling in from, which is the west end of Molokai, the Ahupua'a of Kulokoi. It's a beautiful morning, as you can tell. So yes, really excited to be here with all of you. And I will start our short presentation for you. Sustainable Molokai, or Sustainable Molokai, however you prefer. This is our beautiful logo that was designed for us over 10 years ago, kind of representing all of the momona of the history of Molokai with all the food that's been produced here over the centuries. You know, our overall mission is really to restore āina momona, or abundance, to the land and the people. And when we started out, you know, in 2010, Malia Kutagawa was really our visionary and founder. She and I sat down and said, okay, if we're gonna do this proactive movement to really, you know, encourage sustainability on island, where do we start? Right? I mean, it's kind of a big task, right? So we created this sustainability wheel just to look at all the different aspects that we could address or wanted to address at some point. And you know, the area that really has grown the most and has had the most momentum the past few years has been our food sovereignty program, which is obviously, you know, most connected to the work that you all do. And Kealoha was really awesome in giving us, you know, some background on the programs that AlohaCare is currently undertaking. And I think the thing that really resonated, you know, the values that we share is just that concept that food is medicine, right? We all know if we're eating fresh, healthy, local food, especially cultural foods, that really leads to preventative health, or that is preventative health, so we can have overall community health. So just to kind of give you an overview of the main areas that our food sovereignty program focuses on, we tend to kind of break it into these three buckets. So grow, share, and eat. And of course, the grow side is production, really helping our farmers, both beginning farmers and existing farmers, both with trainings as well as capital. You know, we know farming is not easy if you don't have that capital to really get started. Share is really about distributing that local food to people. We do that through a few different ways that we'll describe in a little bit. And then eat is just really about encouraging consumption of local food, you know, through education and outreach, things like farm to school programs, and our Eat Local Challenge. And so we do all of this with really three main outcomes in mind. And at the top of that is community health. Another great thing about promoting our local food system is it does provide economic development opportunities that really fit with, you know, the lifestyle and yeah, the lifestyle of the community here. You know, it's not so much like a highly developed area, right? I mean, I think most of you know Molokai, our population is about 7,000, and most people want to keep it, you know, kind of keep it rural. So farming is one way that really helps us to do that and still have some economic development. And then, of course, overall, just food security, food sovereignty, and overall resiliency for our island. So with that, I'm going to hand it over to Chris to talk about some of the details of our programs.
Yeah, so to address our intended program outcomes, we currently offer 4 types of farmer trainings. The first is a partnership with UHCTAR, where we offer a garden to farm, and we're going to start a farm to market series this year. And basically, we help small scale gardeners, convert their gardens or teach them fresh, if they don't currently have a garden, into commercial farmers. We have a chicken egg production workshop in partnership with the Soggy Hatchery, where we produce about 12 new chicken egg producers a year. And we have our agribusiness workshops at Go Farm Hawaii, where we help farmers with business plans and organizing and giving them the tools to form effective farm businesses. And then we provide our internship program, where we connect interns with local farmers so they can learn and receive hands-on experience with our local farmers. Next slide. So this is a screenshot of our online mobile market ordering page, so you can get an idea of what our community sees each week when they log into order. Next slide. And so basically our mobile market schedule is here. Every Sunday the farmers update what they have to sell that week. Mondays and Tuesdays our market is open and people are able to order online. Wednesday we pick up the products from our farmers, and then Thursday and Friday we aggregate our customer orders and we deliver it to 2 separate stops. And then due to COVID, we converted to a drive-through method. Next slide. So essentially the benefits for the farmers is they get to name their own price, they get to list their quantities they have each week. And then we they drop off the food to a couple of different locations. We take it and aggregate it for customers' orders. And it really streamlines the process for them, because they don't have to set up like a farmer's market stand and wait for people to come and purchase from them. They know exactly what they're going to sell, and it makes it more economical for them. Next slide. So the benefits for the customers is they get access to these fresh local products. As you saw in the video, because they're harvested fresh and they're not in transit for several weeks, they last a long time. And then our EBT customers get the benefit of double bucks, so they get half off their entire order. And we're the only vendor on Molokai that offers that program. Next slide. So our food hub program is similar to what we do for our mobile market, but it focuses on wholesale customers. And since 2015, we provided this service to schools through our fresh fruits and vegetables programs. We've done a limited amount of distribution to restaurants and stores. But since the pandemic started, we've really focused on aggregating local food for distribution through our food pantry system here on Molokai. Next slide. And so for that COVID response, what we did was organize a coalition with individuals, agencies, organizations, farmers, food producers, to basically address the food insecurity issues that were created as a result of the pandemic. And we received funding from a lot of different partners, including AlohaCare, who initially helped to fund that initiative. And since April, we've distributed over $75,000 in local food, fruit, vegetables, kalo, grass-fed beef, fish, etc. And we've also coordinated the distribution of farm to families boxes of free food in partnership with different organizations. And then we've also distributed over 350 ubi trees to help produce more food for the island. And now I'm going to turn it back over to Harmony.
Thanks, Chris. And then I was just going to wrap up with a little bit about our future plans. So, obviously we want to continue to offer farmer trainings, to continue to increase local production. Of course, we want to continue to increase local food access. We're looking at adding mobile market stops so we can get to more areas around the island. We've added different value-added products. We have some prepared meals so people can, pick up a frozen meal and take it home and make it. And then we also are really looking at building a facility for the island that can function as a food hub and a food bank, for processing and storage and all of those things. So far, we've been really fortunate to have different partners where we've been able, to kind of do what we do at a real grassroots bootstrap level. But we're hoping the next phase is to get a more state-of-the-art facility. And then, the big reason I think why we're here today is that we do really look for progressive thought partners like AlohaCare, that have similar goals and values. And I think together, the more of us that are in this together, the more we can really start to come up with innovative ideas to really engage community in rebuilding our local food systems. And, I just wanted to highlight again that, preventative health and food as medicine, kind of through these programs, we've seen it on both sides. Obviously having access to fresh local food, is kind of the obvious one. But I think the less obvious one that we've seen a huge impact in is with all the people that go through the trainings and the internships, just actually getting their hands in the ground, in the dirt, and starting to grow stuff, and seeing different production techniques. Then all of a sudden this fresh local produce is around, that maybe it wasn't as much before. And so they start to incorporate it into their daily meals, and they've really seen a lot of increased community health through that side as well.
I'm going to launch a quick poll before we go to Matt, and then we're also going to tee up one additional video. So the second poll is coming to you now. Let's see. There we go. So we know that part of the food system are nutritional benefits. So in February 2021, about how many total SNAP recipients received support in Hawaii? So you'll see the number of recipients in thousands. So go ahead and take a vote, and then we'll also provide you the information and the data about this one as well. While we do that, I'm going to set up the share screen so I can prep this video for Matt before he talks.
Seedlings inside, yeah. So whatever one, that 3 of the perlite.
Yeah. I've always wanted to farm and learn how to garden.
The roots died off. It's not about thinking about it, it's about doing it.
The water come into this. We've been working with our current intern to teach her different traditional cultural knowledge that pertains to kalo.
You're gonna kind of drop this train.
We want to start them out small, garden, and then we want to work them all the way up to the farm.
And then they'll be able to take what they learn here and put it on their own land at home.
I know how to grow 50 types of vegetables now, as opposed to last year I knew nothing.
We work with each other.
Farming work is definitely hard on your body, but in the end, when you go back and look at what you've done, it feels really good.
Coming here has really, opened my eyes to the value of raising your own food.
Another great video production. I also saw in the chat that we have Tammy Yamashita also joining us today, and I just love that we find ohana everywhere. I had no idea, so welcome, Tammy. Mahalo for your work, and it's really good to have ohana here to have this important discussion. Matt, I'm gonna spotlight you, and then I'm going to add the other share screen for you, and then I'll mute myself.
Awesome. Thank you. Mahalo ke aloha. Thanks, Harmony. Thanks, Chris. Aloha to everybody at AlohaCare out there. Wish I could see everybody's faces, but it's great to spend this time with you guys this morning, and thanks for the opportunity. So I'm a documentary filmmaker by trade. I've been doing this for about 20 years now. Currently a board member at Sustainable Molokai, but I've been involved with their efforts since the very beginning, over 10 years ago now. Previous to being a board member here, I served 6 years on the Molokai Community Health Center board, so I have some background and understanding in terms of healthcare on Molokai. I think most of you were able to watch the short documentary that we produced about how our community responded to the pandemic on Molokai. And what the pandemic, I think, showed us is that many aspects of the new food systems we're trying to create are actually based on a way of life that resonates with our Molokai community and culture. We already hunt and fish and take care of those in need just by way of our upbringing here on island. To really transition into establishing new food systems that are based on locally produced food that contribute to health and wellness and that support the local economy, we need to create widespread awareness that this can be the norm and not the exception. Unfortunately, the truth is that dependence on unhealthy processed imported foods is deeply embedded by mainstream current food systems, right? So there's lots of work that needs to happen in terms of outreach and education and building awareness that the types of programs and opportunities that Sustainable Molokai and its partners are offering are available to our community. We basically, we have to reprogram people's conditioning about where food comes from, what healthy food looks like, that farming is a viable way to make a living and critically important, and how local food systems work and how they support the local economy, as well as our overall health and well-being. And for me as a filmmaker, this is why storytelling and use of video and social media is super critical. And what's been really exciting is that Sustainable Molokai has been very open to the creative use of media to expand awareness and shift mindset. If you visit the Facebook page that's up right now, or our website, you can check out many of the videos that we've produced in recent years. And many of our videos have gone viral, and we've seen a direct correlation between video-driven social media campaigns and an increase in community participation and support in our programs. Today, Sustainable Molokai is a household name of Molokai, both because of the amazing work that our staff has done on the ground, but also because I think of our effective use of media. Most importantly, we're helping to reshape the way our community looks at food systems, health, and sustainability. I'll end by sharing that over 12 years ago, when I was on the board of the Molokai Community Health Center, we were having these early conversations about, and these are statewide conversations, right, about how food can be medicine and how health centers should work with farmers and build community gardens and those kind of things. 10 years later, that's really become like kind of mainstream understanding and practice. So we've come a long way quickly, and it's really exciting to think where we will be in another 10 years. If healthcare agencies can continue to work hand in hand with community organizations like Sustainable Molokai. So that's the end of my presentation. Mahalo. Turn it back to you, Kealoha.
Matt, mahalo. I was just browsing through those videos with our team, and 120, 160, 190,000 views, people learning about what is kalo is really, I mean, that's phenomenal. These are, I would consider, treasured educational resources that a lot of schools and programs and community health centers could use right within their work as they talk to members of their community and provide, wraparound treatment to their patients. Thank you.
Yeah.
Thank you for sharing all of that. All of your work is so beautiful. Thank you for allowing our staff to view some of it today. I'm going to go ahead and remove your spotlight and bring all four of us back so that we can start having just a discussion. We talked about so many different points here. I want to be able to turn this into a dialogue. I know we have a couple of questions coming in. So, just that big overarching question. Some of us are new to this topic. We might have been trained in other fields before we went into healthcare, and maybe have looked at conventional programs most regularly through our work. So what does community subsistence look like and feel like and sound like to you folks?
What does community subsistence look like? I think, in the documentary that hopefully you guys were able to watch, you see a bit of it, right? It's, it's turning to our environment and nature and the natural resources that we are blessed with here on island to feed our families. Not just in times of need when maybe money is short or the stores aren't open, but just as part of our lifestyle, right? So it's twofold, I think, in terms of keeping us healthy. It's like not only are we eating healthier foods through that kind of living, but we also get out into nature. Like to be a fisherman, you're out on the ocean, you're diving, you're getting sunshine and mental health. Stress relief, or if you're a hunter, you're up in the mountains walking and exercising, and then there's also the family connections and the cultural connections and practices that are handed down. So I think community subsistence here is not just about feeding our families, it's also about continuing traditions and perpetuating lifestyle that does contribute to overall health and wellness.
Yeah, and one thing I would add, so Matt is longtime friends, classmates with my husband, Josh Pastrana, and Josh is he's a star in most of Matt's Eat More Kalo videos and some other videos on our website. You'll see the guy in the Mahalo. So he's, you know, a Kalo farmer, right? And Matt's a fisherman, and you know, it's just a perfect example where they, you know, it's often a trade, right? And then deer meat mixed in there. But I think that's another beautiful part of it, is just how it brings the community together to share whatever their subsistence practices are.
I want to add, Kilo, real quickly that, you know, I know the theme I think I caught in the beginning is what is it, food and environment, right? The environmental protection component is really important too, because if our community did not in recent decades and does not continue today to protect our natural resources from over extraction and exploitation, we wouldn't have the opportunity and ability to go out and, you know, gather food the way we do. So that's another real important aspect to consider when you're thinking about subsistence, is if you don't have the food resources, you can't do the practice. So protecting those resources is very important.
I couldn't agree more. As somebody who lives in a country area, you know, on the island of Oahu, the area that my family resides in now, it's not safe for us to drink the water here. And how essential water is to the food system, I think, is part of the overall community subsistence conversation as well, where if I can't give my child or even our dogs the water out of our faucets, how healthy would then be the food that we want to grow with that same water, right? When it's been designated a Superfund site by the EPA. And I think a lot of the areas that we're talking about have gone through these transitions. And I look to you folks in community subsistence as a way back. We're not only healing people, we're also healing the land and the natural environment that provides us all of this these resources, and the subsistence for us to continue to live healthfully in the way that this land always existed. I wanted to also ask, you know, we're thinking about a lot of new innovative programs at all times at AlohaCare, right? We want to stay ahead of the curve. How can AlohaCare be more mindful and responsive to the food needs in rural areas? And particularly, what are you folks seeing with your friends, your colleagues, and the networks that you folks are a part of for the neighbor islands? It's not just about those of us that live here on Oahu. It's also about all of the islands that we serve, which make up more than 40% of AlohaCare's members. So any thoughts on how we can be more mindful, inclusive, and responsive to neighbor island needs in rural areas?
I'll answer the first part of that question by saying that one of the things we recognize is the impact of hunger and processed foods on disease. And so partly what would help us would be collecting data on the impact of food on health of patients and patient outcomes. And then that will help us in turn advocate for policy changes to promote local and healthy foods. For example, offering refundable tax credits to small and mid-sized farmers, similar to the film tax credit. You know, like we offer a film tax credit in Hawaii, but we don't offer any type of credit or incentives for farmers to produce food. But also having health organizations directly support healthy local food organizations like ours are critical to bridging our work and the work of health organizations.
Yeah, thank you, Chris. And I would build off of that by saying, you know, I think everybody knows, but every island, every community is unique, right? And so I'm also part of the Hawaii Good Food Alliance, and being part of that alliance, you know, we connect with everyone from Malama Kauai to Ma'o Farms, Kokua Kalihi Valley, Maui Food Bank, the Food Basket, you know, all these organizations doing similar work across the islands, but we really all do it differently, right? But but everybody kind of knows their community, looks at what resources they have, look at what needs there are, and then tries to create programs that fill those. And so I love how, Ke Aloha and AlohaCare have reached out to us to be like, what are your community needs and how can we support them? And COVID, really, I feel like has encouraged those conversations, which is super exciting, right? Because it's not a one size fits all kind of thing. It's not like we can be like, you guys should do X and it'll solve the problem, right? It's like you got to talk to every single community, and the Hawaii Good Food Alliance is working to strengthen our own discussions amongst the islands, amongst these programs, and then reaching out to progressive healthcare partners like you guys to just be like, what are your needs, on your side, and what are our needs on our side, and how can we work together to support each other? So yeah, I think continued conversations is really the key. And I think it's a super exciting time. I mean, I think there's a ton of potential for more collaboration.
Matt, anything you wanted to add on neighbor island, rural areas? What are you seeing? You go out and you interview so many folks. You have tremendous documentary productions that expose many of us to areas that we might not be able to go to in our lives, right? What are some of the themes that you're seeing and how we might be responsive and uplift rural and neighbor island areas and food and community subsistence needs?
I mean, I think Harmony and Chris nailed a lot of it. I currently have a contract with the Hawaii Good Food Alliance to tell the stories of each of their partners. And I see a lot of crossover and similarities to what we're doing here on Molokai. And I think it's really about the relationships in the rural communities, right? It's about community members understanding who their farmers are and having those direct connections to them, and that helps build the understanding in terms of what the specific needs are in each community, as well as how to meet those needs creatively and coming up with solutions in those communities, right? There's so much brilliance in our rural communities and creativity, and I think all the solutions are there. But we have to help empower those solutions, right?
Just the idea of getting those tangible data points, right, from the work that we all do is something that, I'm sure a lot of you are familiar with Dr. Alika Mauna Kea's study with the Ma'o farms interns, right, where they studied their whole bio and went through their 6 or 10 month internship program and took their health data points from the beginning to the end, and it was crazy changes, right? And just from doing the hands-on work, and then, like I was saying, being exposed to these fruits and vegetables that they weren't necessarily before. So yeah, doing more studies like that, I think, is critical, because I get it. The healthcare side wants to see, they need proof, right? They're like, okay, why should we just fund you when we don't know what outcomes we're going to get? So the more we can get that data collected, the more we can continue to partner and make that tangible for everybody.
Great points. Thank you. I think that even what you folks are sharing are ways how do we be a good partner, right? How do we go in and uplift the great work that's already being done and the solutions that have already been identified, but maybe don't have the exposure to resources that an organization like ours might be able to help facilitate and build bridges towards. I think those are all really important suggestions for us. I'm going to launch another poll, and this is the last one, but before I do so, I'm going to put the question out beforehand. One of the questions came in because we noticed in the videos and the materials you folks had shared with us, you do a lot of work around educational programming and educational programming across the lifespan, across generations. You're working with schools and you're also working with the university, for example. So one of the questions that came in was, how has the participation in your farmer training programs grown among Molokai residents? The part 2 question of that is, in a formal internship program, how long does this program last? And how many interns would be in a typical class or cohort? While you think on your farmer training programs and how that's grown and describing what a cohort looks like, I'm going to go ahead and launch our 3rd and final poll. Let's see, for everyone to vote on. And this is a question of our own data. Right after Harmony's great suggestion of data is essential. Data drives decision making. Data also drives budgets and resources more often than not. And so this is a question for our team of the percentage of AlohaCare's completed health risk assessment forms that noted a member's need for food. So go ahead and keep voting, folks. I'll keep this open for another minute or two. And I'm going to go back to our panelists on if you can help describe more of the farmer training program, what that looks like and how it's grown.
Yeah, great question. And I have really exciting results to share. We just collated these numbers for, we're always doing grant reporting and writing more grants. So it's fresh in my mind and I could pull it up. So our first real, we did partner with the university a few years ago. They ended up, the Maui College on Molokai ended up shutting down the agricultural program here. And so Sustainable Molokai has kind of filled that gap with just running programs on our own. I mean, obviously in partnership with CTAR and with Asagi Hatchery and farmers, but without the college credits. And so 2019-20, so we did the recruiting at the end of 2019 for our first real cohorts of the trainings that Chris described earlier. And we had about 60 applicants for all three programs, and we could only accept about 30. And then this past cohort, which we just recruited for last December, so for the beginning of 2021, we had about 100 applicants total. And so, yeah, overall, so in the 2 years combined, we've had 153 people apply, and we only had funding and were able to accept 75. So we see there's still a huge demand out there. So that's why we're continuing to write grants, to continue to offer the trainings. And then, people that have gone through like the Garden to Farm program, for example, are now asking for that next level, which is why we worked with CTAR to develop that farm to market, kind of that next level of training, and bringing in people like Go Farm that have all the expertise on the business side. That's really the progression, right? You start out as a home gardener, then you get into production planning and business planning. And Chris has been really great at helping our beginning farmers even just get their business license and then develop their business plan and all that kind of stuff. So it's really cool to see the progression and to see people go through the trainings and then start selling through our mobile market, right? So like before this, we had no local eggs available, right? And now we have tons of local eggs available, so it's really cool to see us, to go from an idea to writing a grant to offering the classes to now working with Department of Health to be able to wash the eggs in a certified kitchen and sell them legally. And now it's happening. So it's really awesome to see that whole progression and to see the demand. People see their neighbors and their friends and hear about it. And so the demand has continued to increase.
And I would say about our egg program, it is so innovative that when we approached the state to get certified to be able to do that, we were the first organization to create basically like a cooperative model for gathering eggs from local producers and selling them to the public. It's never been done before. And Jamie, our food sovereignty program manager, had to write what I call her egg thesis, which is this very long, lengthy document going through the process of how we were going to take care of the eggs from the farmers to the distribution site. And then I will say, for the second question that you asked about how many interns would be in a typical class, it kind of fluctuates. Depending on our funding, so typically it's between 10 to 12 interns. And last year we had 3 cohorts, and the cohorts normally last about 12 weeks. Sometimes they go a little longer or shorter if an intern takes a little bit longer, or they're really gung-ho and they finish it sooner. And then this year, for this year, we're planning on offering at least 3 cohorts, maybe a 4th if we have time permitting, with a similar cohort size, about 10 to 12. And then this year, we're also offering level 2 internships for our more experienced interns. So all of our interns get a stipend. And so our level 1 interns get a $1,200 stipend, and then our level 2 get $1,400.
That's such great information. Thank you so much. I know some of us who maybe went through, our own internship processes when we were in school, or we volunteered for summer programs. I can say I definitely don't ever remember receiving a stipend to be able to do that work at the same time as I'm learning and being mentored by somebody as incredible as like Uncle Bobby, right? Like, there's so much richness that you are thoughtfully weaving into not just building a program, but how the program is touching so many different points of wellness and how it's uplifting the knowledge and the wisdom within your community. So thank you so much for highlighting that work and providing that as another example of how we can start to address more of the upstream causes, right? If we start with youth and young people and they're learning these skills and being mentored by kupuna and elders, how we can start to change some of this over each generation, I think is really tremendous and beautiful. And that kind of leads into my next question of, what advice and recommendation would you have for AlohaCare as we think about, being more proactive towards systems change? We're being asked by the governing bodies to address the root causes of the social determinants of health, right? And so how do we look at the system as a whole and not just, look at individuals? We would love to hear your folks' advice and your own lessons learned along the way that you can share with us.
I did mention a few earlier, which was those types of policy changes. I do want to talk about one program that we didn't bring up, which was a new initiative with the Molokai Community Health Center. And so basically it's called our Aina Rx program. And so they took a subset of their patients who had a particular disease, and that is partially food related. And every week or every 2 weeks, they received a set box of produce from us to help address those disease factors. So starting to think actually treating food like medicine, prescribing it to patients, I think is one of those system changes that if we could do at a statewide level, would really push forward the health and patient outcomes.
So it's also, in other places, produce prescription, there's keiki produce prescription. So a lot of our partners in the Hawaii Good Food Alliance, again, run similar programs, but again, it's interesting to see how they're all a little different, right? Waianae Comp is another one that has a really strong one. So yeah, I think, we've all talked about like learning from each other. How do you guys do it? How do you do it? Who funds it? How can we collaborate to make this really a statewide, like double box, right? It's becoming, we did a collaborative effort on that. Now it's gotten into a lot more of even into the stores, farmers markets. And then I think produce prescription is really a critical area that we're looking at doing next. And I would just, again, reiterate what we already said, but just those conversations, I think, those of us doing like the on the ground food systems work have our perspective and what we've learned from doing this. But then when we talk to healthcare providers or health insurers, we hear what they need, right? Like that's how we learned the data thing, right? We were just like, come on, it's obvious people are healthy because they're eating local food, and they're like, sorry, in the healthcare world, we need data, right? So like having those conversations is just invaluable. Like there's no way to get around that. I mean, that's really the key to all of it.
As a filmmaker and a storyteller, I think we're trying to shift the paradigm, right? And in order to do that, we kind of all need to be on the same page. And so I'll go back to kind of what I was talking about earlier, which is storytelling, messaging, creating awareness, exposing people to the many stories and programs and amazing new initiatives that are happening across the state in all of our communities I feel is really important in doing that, because when you're on the board or you're staff and you're on the ground doing these kind of things, what's happening, what these new programs are. But even in our own community, I meet people every day. They're like, oh, I didn't know about the mobile market. Oh, I didn't know about Double Box. Oh, I didn't know Uncle Bobby was producing food. I didn't know there was an internship opportunity. So to me, it's really about getting the information out there so that there's this shared level of broad awareness. Like, wow, we're moving towards this new goal, and it's very different from where we've been. And this is what it looks like. This is what it can look like. And this is who's doing this and who's doing this and where the opportunities are. So that at some point when we are all on that same page, we're ready and we're already there.
Such a beautiful way for us to think about storytelling and how that message can resonate across islands, can resonate across industries and professions. We had one more closing question for you that came in, and folks are wondering if you folks have collaborations and partnerships across Maui Nui, and specifically looking if any of your Hawaii Good Food Alliance partners might be working in Hana and providing similar types of programs and services in that area of the island of Maui?
We have a little bit, so not extensively, but we have had discussions with Makahana Kaike, and Lipoa and I are connected through this Maui County Executive Director Hui that's been meeting. Yeah, it sounds like they have a lot of great stuff happening out there. I think when they were getting started with their kind of newer farmers market, right, they reached out with questions. We were able to give suggestions like on the software that we use for the online ordering, or another project of the statewide alliance is to start a Hawaii Farmers Market Association. So we have a ton of resources just to, a lot of farmers markets struggle to be financially viable, and then especially to accept SNAP EBT and double buck. So yeah, we've been able to provide some of those resources. And I know Hana and Molokai are really connected, and so I would love to increase that relationship however we can.
I am I'm gearing up to wrap us up today for our brief but well filled and nourishing conversation around food and community subsistence. As I read off the answers to the polling questions, I'll just ask each of you as our panelists today, if there's anything else that you wanted to leave as parting words, or food for thought, maybe as we close out National Nutrition Month here. The answer to the first poll was 86%. Indigenous farming techniques traditional to Hawaii could produce enough food for 86% of Hawaii's current population. Why that's important is because Hawaii imports more than 87% of its food, and our agriculture lands today are only producing about 43% of our food. Much of that food, such as macadamia nuts, are actually exported crops. And so what's being produced on the 43% is not actually staying here, and it's not consumable for a full meal and for a full nutritional palate. That second question that we asked you in the poll in February 2021, just last month, what was the total SNAP recipient rate in Hawaii? And it's the highest number, 198,000 recipients last month. That's an increase of 30% from February 2020 to February 2021. And those other numbers that I had put there is actually the growth rate that we have been noting through the Department of Human Services SNAP benefits over time. And so that's how you see that bar chart is quickly and exponentially increasing month by month, quarter by quarter. We put in a link for you folks also into the chat on the Appleseeds report. An estimated 70% of Hawaii seniors are eligible to enroll in SNAP, most don't. And that economics and economic studies have looked at the cost benefit and the return on investment. And it shows that households that redeem SNAP, for every $1, it generates $1.70 for economic activity. And I think that that really binds well with the videos and the way you folks have woven your storytelling. It's not just about food and the natural environment. It's about income and economy. It's about education and traditional learning. There's so much richness that you brought to us that are truly demonstrated by the needs being spoken by our own communities that we serve and our own members. We're 39% of AlohaCare's members, this is poll 3, who completed their HRA between July 2020 and July 2021, noted that they had a need for food, 39%. And that food costs in Hawaii are 61% higher in Hawaii than the rest of the United States. And so when we talk about food and nutrition month, it's not just, again, about the access to food. It's about making sure that the whole system is set up and it's fair and it's equitable for all, that food is a right just as much as health is a right. If there's any last parting questions from our panelists today, I open the floor to you before we end today's session.
I do want to wrap up by just briefly sharing a personal story about the impact of local healthy food on my health. Before I joined Sustainable Molokai, I weighed 325 pounds. And then after I joined the organization, I started learning about the rural market and about healthy food. And I switched to buying most of my food from our mobile market. And during that period, I lost 75 pounds and greatly improved just my general overall health. So for me, I'm kind of like a personal proof of the impact of food on health. And so, especially since you mentioned that this was National Nutrition Month, I figured I'd share that with a brief story about myself.
Awesome. And I would just say, if anyone needs a, you know, we all need a good laugh here and there, especially lately. So if you ever need a break from work, go check out the videos. Matt is an amazing, not just storyteller, but comedian. So check out the Joshy Boy videos. You know, you can still feel like you're working, but having fun at the same time. And just thank you so much for having us. Mahalo. It was great to be here and talk story with all of you.
Yeah, and I just want to add, you know, the solutions are out there. The creativity is there, the brilliance is there in our communities, and this is how we kind of like, this is how it's going to happen. We got to communicate, talk about it, and so thank you for the opportunity today to do so.
Mahalo nui. I'm going to wrap up today's webinar by deeply giving our gratitude and thanks. Mahalo to Harmony, Matt, and Chris of Sustainable Molokai for their time, expertise, and your generosity of sharing stories and sharing your programs and sharing the impact results that you're driving for the community that you live and work in, where you are raising your families and your children. We want to thank AlohaCare's leadership team for prioritizing the food needs of the communities we serve. And we want to thank all of our team members that joined us live today. There's so many of you, well over 100. Thank you. Mahalo for starting your day with us. You are enlivening a culture of health all across Hawaii by the great work that you do. If you have any questions or ideas, please continue to feel free to reach out to me or Andreas. We want to deeply develop this work across departments. We want to, you know, bring all of our expertise and our lived experience. Please stay safe, everyone. Have a great rest of your day, and thank you for starting this morning with us. Aloha.